Thank you very much, Mr. Chairman and members. This very important piece of legislation addresses the maternal mortality disparity in our state. I appreciate once again the committee staff for working with my team, and we'll be taking the amendments reflected on page 9 of your committee analysis. The American College of Obstetricians and Gynecologists, in their 2017 report entitled Policy on Racial Bias, notes, quote, "The racial and ethnic disparities in women's health cannot be reversed without addressing racial bias, both implicit and explicit. Without examining these disparities through a lens that takes into account race, gender, and class, an equitable healthcare system that serves all women cannot be realized," end quote. SB 464 calls for this thorough and intersectional examination of bias. The bill requires every hospital and alternative birth center to provide evidence-based implicit bias training to all perinatal health care providers. These trainings will call attention to the interpersonal, institutional, and structural barriers to equitable care in order to catalyze a cultural change in hospitals so that all women are assured a dignified experience during childbirth. Although opposition reports that facility-based trainings are not the appropriate vehicle to deliver these trainings to physicians, research shows that implicit bias trainings work and do so best when they are done in person, in a group setting, and are interactive. Senate Bill 464 encourages in-place training with all perinatal staff to maximize the potential of the facility's wide impact. SB 464 will also require the California Department of Public Health to track and publish maternal mortality and severe morbidity rates to better monitor these issues and highlight the areas and demographics that need further intervention. I've got here some witnesses who are going to take a minute, Mr. Chair, to share very personal stories. You know, when you and I talked about this bill, we talked about the disproportionate number of black women who have, on one end of the spectrum, negative experiences with their birthing experience in hospitals and alternative birthing centers, and on the other end of the spectrum, lose their lives. And so Gail Scott is willing to share from Stockton, has come to today to enlighten us and share her personal story. She's a community advocate for seniors' health and rights, as well as Vicki Alexander, who's a retired OBGYN, trained at UC San Francisco, and she's founder and board president of Healthy Black Families, Inc. in the East Bay.
Thank you.
Good afternoon, everyone. My name is Gail Scott. And I'm here today joining with all the women involved in the Dignity in Pregnancy and Childbirth Act. I'm also here to share a little bit of my testimony. So what took place was during one of my pregnancies. I was about 6 months pregnant. I had begun to notice minimal movement of the baby inside of me. And I had an appointment the next day. I went to my regular GYN, who was not there, who was not available, and so I was seen by a nurse practitioner. The nurse practitioner did examine me, and I gave her my concerns of what was going on with me, and she examined me and told me she didn't hear a heartbeat. So with that, I started to question her, and she gave me the answer of come back and do a follow-up with your regular doctor. So I did go back home, and within that 2 to 4 week period, I went into full-blown labor. I'm thankful today that I'm alive today because I found out that my baby was stillborn. My baby had been dead inside of me for almost 4 weeks. My whole internal system could have shut down, could have been poisoned, and I could have died during that situation that I went through. That outcome, I feel, from not being thorough, from me not having thorough attention that I needed surrounding the normal function of my body, my baby, and my baby, it resulted in me having to give the baby a name, give the baby a burial, give the baby a funeral, and it left me in a very depressed state. Thank you.
Thank you.
Thank you.
Thank you first, Mrs. Scott. We really appreciate your testimony. Good afternoon, Chairman Wood and members of the committee. My name is Dr. Vicki Alexander. I have testified in many places, local, state, as well as federal level, around infant mortality for the last 30 years. I'm tired of testifying about the disparities in infant mortality. It's really a time for courageous change, and I think Senate Bill 464 will do that for us. There's just 4 things I want to comment on briefly on the bill. The first is we need more information about the deaths of women and of their babies. Oftentimes, the medical records are not complete. I did a full audit of one of the hospitals in Berkeley. Oops, I guess I gave it away for those of you that might know the area. I did a full audit, and my staff did a full audit when I was a director of maternal child health for the city of Berkeley, of all their records for a 1-year period of time, all their delivery records, to see what biases might exist, and indeed, there were many. We don't need to go into that. We know that. We can tell that there are biases based on infant mortality that is 2 times higher, and maternal mortality that's 4 times higher in the Black community. We can no longer just sit back. But you know, I said that 30 years ago at Mickey Leland's hearing in Washington. But we need more information on our birth certificates that we can then automatically now in our electronic systems share with the physicians that deliver the babies. They don't have to share the names, but they should know of all their deliveries, how many of these babies actually died in congregate, how many of the mothers had problems postpartum and passed away postpartum. We don't even know that as of this point. The physician records are not accurate enough. They need to have it has to come from the birth record, and the physicians oftentimes do not have that. Secondly, I think there needs to be an accountability system for the docs, and this would be one of the accountability systems. There's right now, they're not accountable to anybody. In reality, they're not accountable to anybody. Even to some of the committees in the hospitals, they don't have to actually report on all of the issues that may have risen and what they have done to improve on those issues. Needless to say, things around implicit bias, which is, in the old days, we just called it straight up racism, based on the color of a person's skin. And by the way, when a woman comes in and the nurse says to the doc, we got a 24-year-old Black woman, already that bias is there, hasn't even seen the patient. That is really a problem. So we really need to be able to not only train people around implicit bias, but also be able to have them learn from it and to see their own behavior and how their behavior in a delivery would work. I strongly support Senate Bill 464. It's something that's really got to be done, and we need to get rid of this ongoing inequity between races in this country.